Welcome, dear viewers, to our natural medicine format. Today, we hear an impressive patient report. Dr. Med Thomas Rau, Medical Director of the Sonnenberg BioMed Center in Schwelbrunn, has brought us Pauli. I think it's a story worth seeing and hearing. Stay tuned. Hello, dear Thomas. Hello, dear Uli. Nice to have you as our guests today. I heard briefly beforehand what it was about, and I was very impressed. Shall we just start with the story, or would you like to say a few more words?
Actually, it's not necessary. Thank you for letting us come at all. I'm going to show 3 cases today. It's always about the fact that these people had very difficult sufferings or several ailments and were not sufficiently treated by conventional medicine. In some cases very well, but not sufficiently. And then these people came to us, long-term or even acutely. How we approach the matter with so-called biological medicine and what we actually do other than conventional medicine or in addition to conventional medicine.
Exactly, I like that. We've already seen in the preliminary discussion that it should be a collaboration and a complement. Dear Uli, I think it's great that you've taken on this journey and that you have the courage to actually report this in front of the camera. I find that so valuable, perhaps the most valuable thing of all. Maybe we're just starting with your story.
I hope it works. I am not related to Dr. Rau, nor am I being paid for my appearance here. My aim is to shed some light on the confusion. I have known Dr. Rau for over 25 years, and I have gotten to know him. I got itching on my face, which became extremely unpleasant. The usual route via the family doctor to the specialist dermatologist in Zurich, the first specialist, the second specialist. Then to the university hospital, where my face is projected onto a large screen, 4 by 5 meters. Various doctors and professors gave me advice in hieroglyphics and with terminologies that I didn't understand. No one found the point. And since I deal with clients as an architect, a client came to me and said, "Hey, Pauli, why don't you go to Dr. Rau at the Lustmühle?" In the meantime, 7 months have passed between the itching and the university hospital. 7 months. Cortisone salvo, antibiotic salvo, and all sorts of things tried and tested. Nothing helped. On the contrary, it got worse and worse. My first visit to Dr. Rau in the Lustmühle was an epiphany in the truest sense of the word. Within a short space of time, DAC, once fully suspected, tackled it precisely, and now the numbers are coming in. 5 is the lowest limit, 20 is normal, 50 was the highest limit. That's what I was told at the time. And for me, the number was 950.
Unbelievable, yes.
I could no longer see clearly. As an architect, that's a disaster. I was sent to the optician and the ophthalmologist first. The optician prescribed me glasses. As an architect, I saw the lines bent. Doesn't work. I'll come back to this later. And Dr. Rau was the first after 7 months of odyssey from one doctor to another who got to the heart of the matter within a short time. Amalgam all out. At the time, I had a dip with the business. I couldn't afford it at the Lustmühle. Another architect, builder, showed me the way, helped me. In Cannes, in the south of France, there is a young organic dentist. Do that. And then I have a fraction of the cost in the south of France in one session of Friday 7 o'clock, Saturday all day, and Sunday until 6 o'clock in the evening. Lying almost continuously with an open mouth, and he removed all the amalgam. After that, I had a day off before driving home again. And on Tuesday morning, I drive home and I was able to read the signs again on the highway.
Very impressive. Now, I can ask you, Thomas, because normally you have to be a bit careful with the amalgam removal. That was quite a tough course, I would say, altogether. Or how do you see it?
Well, I would like to give a little more back. Of course you can ask, why doesn't everyone who has amalgam fillings in their teeth have such problems? These are cumulative stories, that is, toxicities complement each other. And of course I knew his history. I'm allowed to say that. That was natural. He also had chemotherapy. And that is once again an extremely toxic burden. And of course I knew that. That's why I was particularly sensitive. Isn't there a cumulative, a polytoxicity? Now the question, we wouldn't have done it this way, but we are a bit more cautious. That's why I told him afterwards, but now we have to drain. And this drainage with this mammoth amalgam removal, quite a lot is still absorbed in the body. And we're there with our dentist. We're still very subtle and meticulous. That's why I said afterwards, now you just have to drain it very intensively. You can detoxify the body afterwards. Because he wasn't sick because of the fillings, he was sick because of the toxicity that came into the person from the fillings over the years.
Very, very impressive. And that's not where the story ends.
There's something else, if I may add to that. The dentist, of course, registered how highly poisoned I was. He said, I can't give you an injection. The liver can't do that. And he treated me in the south of France on a dentist's chair without clothes, with acupuncture down to my little toes. And I have had no pain.
Very impressive.
So the story is finished. Dr. Rao has completed it excellently. I'll go one step further. With the chemotherapy, I told him that he added that. And after chemotherapy, the immune system is weakened to the point of being completely down. I've only had colds from the sinuses, to the larynx, to the bronchi, to pneumonia. And that's where Dr. Rao comes in again. He gave me infusions and the so-called flu prophylaxis. Flu prophylaxis is a supplementary injection into the muscle flesh. And I think we do the injection every 3 months in the winter months to strengthen the immune system. The success for 3 years, practically no more flu infections. I'm stable. And as a freelance, that's the tool for me, which has to work.
And also in terms of energy and so on.
In terms of energy, I'm fully active. And we can tick that off too. And then we come to various other things. Dr. Rao used to be the second address for me. When I didn't know what to do, I went to him. That has changed. Today, this is my first address. I went to an otorhinolaryngologist in London because I had bad hearing on one side. Treated for almost half a year with hearing test and hearing test. No results. Changed doctor to Zurich. 4 months again. No success. I come to him. The conventional doctors have diagnosed me with a sudden loss of hearing. I go to him, he looks at me and says, it's not sudden hearing loss. Then we did MRI, I'm quite sure. And then he did a needle stick and an injection. I think twice, I'm sure. And that dissolved into nothing. I come back. That's not positive for me as a language teacher. If I don't hear one side speaking and I hear the other side well. As a language teacher, I can really say that the problem is solved. Then I get pain in my knee. I go to the conventional doctor. They say an operation is necessary. I go to Dr. Rao, get a second opinion. One of them says we can do it differently. I give myself an injection. I don't need an operation. I'm running again today.
Wonderful. Then perhaps I'd like to interrupt. I still have some questions. These are such impressive stories. I would like to ask about this flu prophylaxis. How does it work? This is certainly an important topic for many people at this time of year, that there is still an alternative to the vaccination.
We call it flu prophylaxis, but it's actually an immune-boosting measure. These are remedies, all biological or homeopathic remedies, or isopathic remedies, which we combine with vitamins and immunostimulating substances, like vitamin D and selenium and so on, and give it to people intramuscularly over the winter months at 2-month intervals, so that the patients can imagine something. We call it influenza prophylaxis. But that has nothing whatsoever to do with the flu vaccination.
That was also important for me to distinguish. That actually means it's like supporting and stimulating the immune system.
Exactly. You could also do that during the year. We just do it in the winter months.
Then I have another question about the treatment of sudden hearing loss or tinnitus. These things are almost considered very difficult to treat. How did you go about it, or how did you realize what it was? I find it so amazing how succinctly you can make the diagnoses.
Yes, the conciseness comes solely from the fact that we look at the whole person. Mr. Pauli went to super specialists, and they didn't get it right. Then I must logically think that the cause could be somewhere else. Mr. Pauli had chemotherapy. Mr. Pauli had this massive exposure to mercury, which was removed. But that doesn't happen so quickly. This toxicity remains for a very long time and can also express itself in other organs. No other organ except the eye has more nerve cells per square millimeter. These toxic exposures, both the chemo and the amalgam, are neurotoxins. Once again, this was the detoxification. To improve that a bit quickly, I injected twice. Of course, it wasn't just injecting twice. With neural therapy, we can easily change the hypersensitivity of the fine nerves. At the same time, we also treated his cervical spine. That's why I'm doing this MRI, to see if the cervical spine isn't one of the reasons. With tinnitus, it is very often the case that the cervical vertebrae are not correct.
Impressive what you told me in this short sequence. How many things are taken into account? Otherwise, it's like thinking you can change a spark plug in a car. You don't look at the whole system. People are so complex.
Humans are not machines. Everything is very much connected. Unfortunately, overspecialization in medicine, that's a big problem in medicine today, that these connections are simply no longer looked at. That the cervical spine or toxicity may have a connection with this nerve organ.
Very impressive. And how much suffering can be prevented? I'm sure you can say that too, if you just can't get any help with something. And then you stand there with the so-called specialists, and mind you, they want conventional medicine or specialists. They are also important, but that you always see the whole picture.
So I would like to mention something interesting in this context. I had a disturbance of consciousness while driving. And then there was the so-called sudden loss of hearing. And now comes what Dr. Rao said correctly, the combination. So with these injections, he has eliminated both the disturbance of consciousness for the future and also eliminated the so-called hearing loss. So two ailments are solved in one. And what I don't like about conventional medicine and biomedicine is the lack of communication between conventional medicine and biomedicine. So there really is a need for action. And in my opinion, not on the part of biomedicine, which probably wants this, but conventional medicine seems to me to be blocking something that doesn't serve the purpose.
I interrupted you before because I just wanted to hear Thomas Rao's point of view. You had another problem that was solved.
No, that's the woman with the knee. The same thing. Knee pain. At that time, the detour via the Orthodox doctor X-rayed showed me where the problem was. You can't judge that as a layman. And the operation was essential. And then I made my way back to the Lustmühle, I think, to Dr. Rao. Dr. Rao looks at the x-rays and says, let's not do an operation. We solve that differently. And then again with an injection, and the pain was gone in a very short time. That was 2 years ago. I have absolute peace and quiet. Now I come to the costs. The otorhinolaryngologist, half a year was paid for by the health insurance company without any problem. The hearing loss from the other otorhinolaryngologist, 4 months, was paid for by the health insurance company without any problem. And now, of course, I have the natural medicine in there. But what bothers me personally, if I go to Dr. Rao now and he does the flu prophylaxis with me, then I don't have to go to the pharmacy or the school doctor and order antibiotics and a sore throat and all the rest of it, which was incredibly expensive. And here I take the direct route. I go to Schwelbrunn twice in the fall, and I'm free of all the hassle. The cost efficiency is added to that.
Yes, that's also very, very impressive. Now I'd like to go into a little more detail. So the knee, what kind of operation would that have been?
I'm not a doctor. I have to live with what you tell me. If you say you have to do an operation, then I associate that with time off work. 3-4 weeks with 2 crutches and 6,000, 7,000 francs in costs. I can't judge it. I can only assume that's where it's going, and that's why I'm here. I'd like to draw your attention to the madness, the insanity, the money that's being lost. And on the other hand, finding a quick diagnosis, that's the core of the problem, where it's needed. And the faster it is found, the more and the more directly the treatments can be started. And so more targeted.
Absolutely. Now, I'd like to know if it was osteoarthritis in the knee or what.
Yes, it was and is osteoarthritis of the knee joint. That would be an artificial knee joint, a replacement operation, a new knee is put in. This mechanistic thinking is very, very widespread. What is simply not taken into account is biological medicine. We build the body cell by cell. And even at his age, at my age, the body still has a regenerative capacity. And that's where we start. I don't just give a cortisone injection in the knee, and then it gets better quickly. 14 days or 2 months. No, we rebuild the human being, the cartilage, but also the entire muscle system at the same time. It's not just an injection, but the idea of reconstruction. And with him, I'm allowed to say this, he had a highly malignant tumor, which was treated excellently with the very latest chemotherapeutic agents. I am not against these therapies. But what is not done afterwards is to rebuild the body. And his tumor, he knows all this, would have a very high risk of recurrence. It's a tumor that unfortunately almost always relapses. But not in his case for years now, because we are constantly building up the immune system and are simply always working and renewing the body. That's extremely important, especially in the third phase of life.
It turns out that I have 5 phases of life.
Yes, exactly. You speak from my heart in 2 respects. Because these frequent and quick joint prostheses, i.e. replacements or operations, the idea of rapid replacement, like changing a tire, that has so many more consequences. And if you can treat it like that, that's wonderful. I find that very hopeful, to hear that too, that people are not always so quick to resort to the last resort and replace the joint, but that there are options. And the other thing that I personally experience again and again with people around me, that after cancer, after a long course of chemotherapy, afterwards there's hardly any talk about detoxification. None of that at all. And that horrified me every time, because I think everything else stands or falls with that. So that's my conviction, or most of it. And I think what you've just said is very, very important, these points.
Any cancer treatment can be very successful under certain circumstances. The tumor has been removed, but why is it coming back? Because you don't treat the cause and because you don't build up the immune system. That's so important, and it just takes years. So you have to do it for the long term. The best thing about my patients is that the longer they come to me, the healthier they get. And in the end, they are no longer ill. Now he, for example, he has had so many sufferings, but now he doesn't have them anymore. But he's doing this restorative treatment with vitamins and all that stuff that are unfortunately so attacked by conventional medicine nonsensically. He just does it all the time. And my patients, they go along with it. I only take patients who are willing to integrate themselves into their health.
I think that might just be a nice closing. And it was very, very impressive, this report. And I think it's really nice that people have the courage to really tell the story and also to be open, that you can just call it that. Because I think that's really the most meaningful and very impressive. And it really went through my head during the conversation, what would have happened if you hadn't had this support? And that opened up a big question for me. I think it's wonderful how you work. And it touches me very much. And I find that really remarkable. Thank you very much, dear Thomas.
Thank you too.
Thank you very much, dear Uli.
I also think the note is still important. It's not against conventional medicine. No. There are cases of cancer where chemotherapy has to pull the emergency brake. It's all about reaching the goal together, that one recognizes the other.
Absolute.
That's my point. And that's the most important thing. And that's not working today. There is a need for action.
Yes, and you speak from the heart. And that's what Thomas said so well about the excellent treatment, just that you have mutual respect and recognition.
That's the key point.
Yes, another nice closing. So thank you both very much.
Thank you too.
Dear spectators, thank you very much. I don't think this impressive story needs many more words. I hope for another time. Stay healthy and goodbye.